Hi, in this series of videos, this is the third video about cardiovascular system. We'll be specifically looking into the pathology of valvular heart diseases. These valvular heart diseases are really important and are really significant to understand. So let's understand how they work. See, we all know the four major heart valves, right? The aortic valve present between the left ventricle and the aorta, and you have the mitral valve present between the left atrium and the left ventricle. You have the pulmonary valve which guards the pulmonary trunk from the right ventricle, and then you have the tricuspid valve which is present between the right atrium and the right ventricle. So remember the four important valves. We will be seeing some diseases that affect these valves. Okay. Before understanding what those diseases are, I want to explain a basic concept to you. Okay, let's take this is the chamber of the heart. This is the chamber of the heart, and this is the opening. And let's say this blue color would be the valve. Okay, the valve. Now, what happens in stenosis? There is an obstruction. Okay, there is an obstruction in the opening. So let's say there is an obstruction like this. So it becomes stenotic. So if that becomes stenotic, usually the blood wants to, when the heart contracts, right? When the heart contracts, the blood wants to escape through this opening, right? But if it's obstructed, this opening is going to reduce. As a result, the amount of blood escaping the chamber of the heart is going to reduce. Right. As a result, pressure builds up here because a lot of blood accumulates, is not able to escape easily and very quickly. There is a buildup of pressure inside this chamber. Okay. And if there is pressure buildup, as a result, what will happen to the cells of the heart? The cardiac myocytes will hypertrophy to compensate. They will also grow big. So there is hypertrophy seen. Alright. So stenosis is primarily related to pressure. Now, what about insufficiency? In insufficiency, what happens? This valve right here becomes incompetent. So, usually in the phase of relaxation, after the blood flows out of this chamber, right? After the blood flows out of this chamber, you want this valve to be closed so that no blood enters back. But in this case, this valve becomes loose. As a result, blood leaks into the heart chamber. Okay, so in the phase of relaxation, you don't want blood to enter this chamber. You want blood to flow outside and you want to stay it in the next chamber over here. But if this blue color valve becomes weak, then as a result, blood leaks back into the chamber. That is called insufficiency, and that is mainly due to the leaky blood returning to the chamber, which is your increase in volume of blood. Okay. So remember, stenosis is due to increase in pressure, insufficiency is due to increase in volume. Now, due to the stenosis and insufficiency, there are certain things that can be heard in a physical examination. And that are your murmurs, your thrills, and there are jets of blood. So what is jets of blood? Nothing. The passage of blood like a jet stream. Instead of a plane or a mass flow, there is a single stream of blood flowing if the obstruction is severe. That is called jets of blood. And in the PE, you will be observing murmurs and thrills. Okay. Now, what are all the etiology? What is etiology? Etiology is the cause of these specific heart diseases affecting the valve. Let's take mitral valve disease. Mitral stenosis is primarily caused by your rheumatic heart disease. We will be studying about rheumatic heart disease in detail. Aortic valve disease. Aortic stenosis is mainly due to rheumatic heart disease. Some senile calcific aortic stenosis. What does senile mean? Aging, due to aging. So due to aging, there is calcification. As a result, there is stenosis, and then calcification of congenitally deformed valve. What about mitral regurgitation? These are all the causative factors. What about aortic regurgitation? These are all the causative factors. Just take a look at all these causative factors. But apart from this, there are two other things that I want you to know about. First is BAV. What is BAV? It is bicuspid aortic valve. Yeah, I've written it down here. BAV is bicuspid aortic valve, and this is seen congenitally in few people who have a mutation in the gene Notch1 gene. Okay, remember, usually the aortic valve has 3 cusps. And if you remember our anatomy video, out of those 3 cusps has 3 sinuses, and from 2 sinuses your coronary artery arises. But in this case, this aortic valve will have only 2 cusps. Okay, so bicuspid aortic valve. That is due to Notch1 gene. What about mitral valve prolapse? So what happens in this is the mitral valve prolapses into the other chamber. So let me draw it down for you. So the mitral valve is present in the left side of the heart, right? So remember, just take for example left atrium, left ventricle, and you have the mitral valve here. So what happens? This mitral valve goes backwards, okay, and as a result there is insufficiency, okay, and this is usually seen in patients with Marfan syndrome who have a gene mutation of fibrillin 1 gene and TGF beta, and this is generally due to myxomatous degeneration of the valve. Okay, so remember these things, the causes of mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation, and remember what is bicuspid aortic valve and mitral valve prolapse. Now let's look at each of these conditions in a very simplified flowchart pattern. Okay, I've created these flowcharts to simplify it very easily so you never forget it. Okay, so first, mitral stenosis. What's the cause? Could be due to rheumatic heart disease, congenital heart defects, or calcification of the valve, which causes stenosis obstruction. And remember once again, stenosis is due to pressure, increase in pressure. Now, as a result, what happens in the pathophysiology? There is valve obstruction. Because of valve obstruction, the blood, remember, take this is the left atrium, left ventricle. So there is obstruction here. As a result, blood cannot enter the left ventricle freely. As a result, there is increase in left atrial pressure. See, that's what is happening here. If there is increase in left atrial pressure, what does the left atrium receive blood from? It receives blood from the pulmonary vein, right, to the lungs. So as a result, there is pulmonary hypertension. If increase in LAP, increase in pulmonary vein pressure, as a result, increase in pulmonary hypertension. Now, where does the lungs connect on the other side? Remember the right ventricle, it gives rise to your pulmonary trunk, right? So let's say this is your, okay, let me make a better diagram here. This is the left atrium, this is the left ventricle, right ventricle, right atrium. Imagine this is your lungs. Okay, so now there is an obstruction here. As a result, pressure increases here. Pressure in the pulmonary veins increase. Pressure in the pulmonary increases. And as a result, you remember the right ventricle is connected to the lungs by your pulmonary trunk. So the pressure in the pulmonary trunk increases. As a result, pressure in the right ventricular chamber also increases. That leads to right ventricular hypertrophy. Remember, if there is more pressure for compensation, the cardiac myocytes increase in size. That is called a right ventricular hypertrophy. So it's essential to remember here that obstruction in the stenosis in the mitral valve is causing increase in pressure in left atrium, as a result in the pulmonary veins, in the pulmonary circulation, in the pulmonary trunk, and finally in your right ventricle. That leads to your right ventricular hypertrophy. See how simple the pathophysiology is. Now what about the clinical manifestation that the patient will have? The patient will be experiencing symptoms like dyspnea, difficulty in breathing, fatigue, tiredness, palpitations, you can hear your heart sound out, fast pacing heart sound, and hemoptysis, that is coughing out of blood because of your pulmonary hypertension. Okay, now this is just a pictorial diagram of what a mitral valve stenosis is. See, this is the top view. You have a normal mitral valve. Let's see how occluded the mitral valve is. It's stenotic. As a result, pressure buildups, and you know the pathophysiology now, right? Okay, now what about mitral regurgitation? Same. Let's talk about causes. Could be due to mitral valve prolapse. Remember, MVP, it is seen in Marfan's patients and in patients with gene mutations of fibrillin 1 gene and TGF beta. Rheumatic heart disease, infective endocarditis, and ischemic heart disease. What's the pathophysiology? So there is incomplete valve closure. As a result, there is more blood entering the left atrium, more volume of blood entering the left atrium. So as a result, there is left atrial enlargement. So the left atrium is enlarged in mitral regurgitation, and that leads to increase in pulmonary pressure overall. Okay. Now what about the clinical manifestation? You have dyspnea, fatigue, palpitation, and pulmonary edema because of increased in pulmonary pressure. See, this is a pictorial representation of what a mitral regurgitation is. See, this is a normal mitral valve, does not allow leaky backflow of blood into the left atrium. But here you can see a prolapse is there. The mitral valve is prolapsed into the left atrium. As a result, blood is leaking back into the left atrium. When originally blood is supposed to travel only in this direction, there is a leak back of blood, increase in volume, increase in pulmonary pressure. Okay. So when you understand the pathophysiology, the concepts become really easy. Now, what about aortic stenosis? Let's take the causes. It could be due to congenital bicuspid valve. Remember, bicuspid aortic valve, BAV, age-related calcific changes, and rheumatic heart disease. What is the pathophysiology? The aortic valve becomes stenotic. As a result, if the aortic valves become stenotic, where is the aortic valve? It is between the left ventricle and the aorta. Let's say this is the aorta. Okay, it becomes stenotic. As a result, the blood is not being able to pump here. As a result, blood accumulates here, the pressure builds up here, and there is left ventricular hypertrophy. If there is left ventricular hypertrophy, the left ventricle cannot pump enough blood through your aorta. As a result, your decrease in cardiac output is seen. Okay, so this is another pictorial representation of how an aortic stenosis looks like. See here, this is a normal aortic valve, but this here is a stenosed aortic valve. There's literally no space, so there's a jet of blood flow here, jet. Okay, now aortic regurgitation. What about aortic regurgitation? Causes could be due to, again, congenital bicuspid valve, rheumatic heart disease, infective endocarditis, or aortic root dilation. Now, you need not go into the detail of the causes because we'll be handling rheumatic fever and heart disease in this video, but about the other causes we'll be seeing in other videos. Okay, but now let's just focus on the pathophysiology of the valvular disease. So what happens in aortic regurgitation pathophysio? There is incomplete valve closure, so there is regurgitation of blood back to left ventricle. So remember, this is your left atrium, left ventricle, and your aorta. See, this is just a pictorial representation, okay? It doesn't represent the exact shape of the heart. You need to understand that. So if there is regurgitation, there is backflow of blood here, insufficiency. So as a result, the volume increases, left ventricular volume increases. As a result, there is left ventricular hypertrophy once again. So mostly every pathophysiology is the same. You just have to understand where it happens and what happens first. Okay. The clinical manifestation is dyspnea, fatigue, palpitations, and eventually your heart failure, left-sided heart failure. Okay. This is a pictorial representation of aortic regurgitation, in which you can see there is a weakened aortic valve, there is prolapse of aortic valve into the aorta. As a result, there is leakage of blood from the aorta into the left ventricle. Okay, now let's talk about rheumatic fever. I've really simplified rheumatic fever too, because in third year you'll be learning more about rheumatic fever, but for the second year patho level, this is enough. So in rheumatic fever, the cause is mainly due to a group A streptococcal pharyngitis infection. Okay, so when when a child has a pharyngitis and that is due to group A streptococcal infection, then that is highly likely to lead to rheumatic fever. What's the pathophysiology? It is due to the immune response to this causative organism through a mechanism called molecular mimicry. Okay, as a result, there is inflammation of heart, joint, skins, and your central nervous system too. Okay, what are all the clinical manifestation? You will have carditis, inflammation of the heart tissue, polyarthritis, Sydenham chorea. You will have erythema marginatum, which is a type of cutaneous manifestation, dermatological manifestation, and you will have subcutaneous nodules. Now let's look at it. So as I said, remember the Jones criteria for rheumatic fever, about which you will be looking more in detail in third year. So the patient is having a fever of greater than 38 degrees Celsius. You will have joint pain, carditis, nodules, erythema marginatum, and Sydenham chorea. Remember the mnemonic is Jones. And this is erythema marginatum, the cutaneous manifestations that you will see. And this posture is called your Sydenham chorea. Okay. So that ends the discussion of valvular diseases. This video is in the scope for a second year student. This is not in the scope for a third year student. In internal medicine, you will be learning a more detail about all the valvular diseases and the treatment plans and rheumatic fever, the criteria, Jones criteria, Duke's criteria, and all those things. All right. I hope this video really helped you clear your concepts about valvular disease and you were able to understand. And once again, our motto is not to memorize, but to understand the concepts and the pathophysiology behind it.